Greetings. This is Dr. Fisher with Road2Wellness, always looking and lurking for ways to improve your health. If you are over the age of 30, then this video is definitely for you. If you live in the Western Hemisphere and you're eating a typical Western diet, this video is certainly for you. Have you noticed that as you have begun to age that you have some extra padding along the midsection, or you may be having complications with heartburn, acid reflux, bloating in the stomach, or constipation, which is even worse? You're not going to the restroom every single day if you're eating. Well, all of these can be signs of detrimental health concerns for your colon. And so, what I like to do, which is one of the number one things we do here, is show people how to correct their diet. As we begin to age, we start to produce less hydrochloric acid in our gut. So that's how come we get that extra padding around the midsection, because our stomach has less hydrochloric acid to digest food, to break down different types of meats that we're eating, any type of carbohydrates you eat. So we don't have the acid that we need in order to fully digest our food. So there are a few things that I want to share with you because I think it's life threatening, and I think that you can stay here on this planet an extra 15 to 20 years if you listen to what I say and you adhere to it and you take action. When it comes to digestion, your stomach has the ability to absorb like B12, iron, calcium, magnesium, and so many other nutrients, and allow your body to go in and extract those minerals and vitamins so that the rest of your body have the ability to use it. If you don't have much HCl, then it can create colon cancer. It can create tiredness, fatigue. So what's important is that you understand the importance of, there are three things that I'm going to be talking about, which is digest enzymes. What they are is they're pancreatic enzymes to help you break down carbohydrates, fat, protein, and dairy. So as soon as you start the beginning of a full meal, you would take these and they help break these foods down. Then you would take a little bit of betaine, hydrochloric acid, which is just stomach acid, to help break the food down and then send the food to the back door. This is why you should be having a bowel movement every day if you're eating every day. So it's so important. And some of the things I want to explain, that if you're having some of these issues, and I like to have this information handy because I want to make sure I don't miss anything. If you're experiencing eczema, which there are tons of people experiencing eczema, acne, asthma, diabetes, osteoporosis, arthritis, hepatitis, lupus, thyroid issues, all of these are diseases associated with low acid in the stomach. So it's very important that you begin to think about what you're doing in terms of your digestion health. So back to what I was saying, the digest is something you would take before you eat. HCl is something you take after you eat. And what it does is it allows your stomach to break down. So those that are having challenges with weight and they're struggling with how to get weight off, a lot of times start looking at your digestion system. A lot of my clients do come in and say, Dr. Fish, I go to the bathroom every day. I don't have an issue with digestion. You would be surprised at how much food is still clogged up in the indentions of the colon that you're not aware of. So you may have a bowel movement, but you may not be accurately digesting the food. So digestion and having a bowel movement are two different things. Digesting means your stomach is and your small intestines is breaking the food down. Your body's receiving the nutrients, and then you are able to remove the fecal matter so that it doesn't produce toxins. Having a bowel movement means that none of the food was broken down. It's sitting in the colon waiting on something else to come through and push it through. Then you have a bowel movement. And in this fashion, you didn't get a chance to absorb the B12 that was in the food, or any of the omegas, or any of the calcium or the magnesium in your salads. You didn't get a chance to properly digest any of that. So it's very important to understand that digestion can lead to a lot of things. About 40% of the people that are over 30 really struggle with this. And then as you get older, that percentage is even higher. So it's very important to understand why digestion is important. So when you hear someone who has colon cancer, it's because they've gone many, many years without digesting food properly. So keep in mind, cleansing the colon often is very important. So again, if you're experiencing symptoms of things like bloating, constipation, heartburn, acid reflux, gas. These are all signs that your stomach is not digesting properly. So I highly encourage you to take a look at something that's life changing, life saving, and would just make a huge difference in your life. Thank you again. This is Dr. Fisher with Road to Wellness. And if you have any questions, you can give us a call at 713-520-8188, or you can email us your questions at drfisher.road2wellness@gmail.com. That's DRFISHERROAD, the number 2, wellness, WELLNESS @gmail.com. And remember, your health is your wealth.